Welcome to the Recovery.com podcast. I'm your host, Dr. Mala, and today I'm excited to welcome Dr. Kiki Fehling, a clinical psychologist and DBT board certified expert in dialectical behavioral therapy with a focus on suicide prevention, emotional sensitivity, trauma, and LGBTQ plus mental health. Dr. Fehling combines research expertise with a passion for advocacy. She's also the author of Self Directed DBT Skills, a 3-month workbook, and the DBT cards for coping skills. It's sitting right behind me here. And she built these tools to empower individuals to navigate life's challenges with resilience and self compassion. So excited to have you on with us today. Welcome, Dr. Failing.
Thank you so much for having me. I love how you just described my books. I feel like I don't usually mention self compassion in describing them, but that is absolutely a huge part of what I care about. So I love that you said that.
Thank you. Yeah, so let's dive right in. What first drew you to the field of psychology and what inspired all of your specializations?
That's a great question. So I got into psychology, I would say, via theater. I was a theater kid growing up, and my favorite part as an actor and a director, at least, was trying to understand the life experience of the characters with a totally different history than what I personally had experienced. And I just loved trying to understand the human mind. That when I got to college, I studied psychology, and then it became pretty obvious to me quickly that I also really enjoyed helping people. And so one of my biggest kind of goals and values in life is decreasing suffering. And when I realized that clinical psychology was a good way to mix these two passions of mine, understanding the human mind and helping others, that's why I went that direction. And I can say so many reasons for why dialectical behavior therapy resonates with me specifically, but I personally have struggled with mental health issues and I'm an emotionally sensitive person. And I've had friends that have died by suicide and have struggled with self harm. And that I would say that personal and lived experience and having loved ones struggle is what brought me to really specialize in this area of DBT because it's so life changing and life saving for folks with the most intense suffering. So that's a little bit of an arc of how I got here.
I love it. So much of your story resonates with me as well. I think one thing that we know as clinicians is that there's always a reason that we're going into this for ourselves too, to work through our own issues. So it's great to be able to not only talk about that, but also know that we can use that to move forward in it with our passion. So that's really great. Let's talk a little bit about DBT. Can you break it down for us and what are some of the common questions that I think people have as they start to explore therapeutic methods and like what to go with and why DBT?
I love it because DBT is very complex, and the questions I get about it are there's kind of a bunch of different paths that folks often are interested in, and I think you caught like the main ones. So one of the biggest questions I get asked immediately usually is what is dialectical? So maybe
Yeah.
we can start there. What is the D in DBT?
Mhm.
So dialectics is a philosophical framework, a way of viewing the world that recognizes that two seemingly opposite things can actually be true at the same time. And the reason why that's such a core component of DBT is because it was designed to help people who feel emotions really intensely. Specifically, it was developed to help folks with borderline personality disorder that has since been shown to be effective for other folks who struggle with emotions, broadly speaking. And I'm sure we'll talk about that. But when people feel emotions intensely, a really common experience is they will also struggle with what's called black and white thinking.
Yeah.
So
Mhm.
that can make you feel really hot and cold within relationships. It can have you struggle with really intense hot and coldness towards yourself. So vacillating and going back and forth between self love and self hate. And really just viewing the world as all good and all bad. Because when anybody feels an emotion like 10 out of 10, we're going to have really intense thoughts to go along with that emotion. And so when DBT was created to help with intense emotions, dialectics were a huge part of it. How can we help people view the world in a more balanced and accurate way, aka dialectically, when they struggle with that intense black and white thinking because they struggle with intense emotions as well.
Mhm.
So that's one part of DBT that's worth
Yeah,
mentioning.
for sure. Yeah.
I would say that the other big part of DBT is that it is a type of cognitive behavioral therapy. So, at its core, CBT gets at the idea of thoughts, emotions, and behaviors all interact with one another. So, if you struggle with emotions, changing thoughts or changing your behaviors can change your emotions, and vice versa, that all these things interact. And so I think that kind of really concrete, challenging negative thoughts or changing problematic behaviors is a thing that can help certain people who are feeling like they're struggling with impulsivity or feeling out of control in their lives. DBT, especially, but CBT as well, provides very concrete instructions and guidance for how can I create change in my life? How can I stop doing things that I no longer want to be doing and do things that I want to be doing? One of the main things that differentiates DBT from CBT is that one of the main dialectics is the tension between change and acceptance. So I just mentioned CBT is really good at problem solving and change and like changing your life and changing your behaviors. But a lot of times for folks who struggle with intense emotions or who have trauma histories or have faced like marginalizations with minority identities, there can be a real pushback against change. So DBT offers a whole other stream and column of acceptance based skills. So
Awesome.
another big part of DBT is mindfulness, acceptance, and
Yeah.
other types of skills to help people tolerate the difficulties in their life, to accept and acknowledge the realities of their lived experience and their histories
Yeah.
as they balance those CBT skills with that.
It's a powerful tool for addressing sensitivities, traumas,
Mhm,
and you mentioned also marginalized communities too. I think I'm gonna jump to one of my other questions. What are some of the unique challenges that you've observed within these marginalized communities, and how has your work really helped with addressing them with
mhm.
and utilizing DBT? How can it help?
So, right off the bat, I wanna say that I think that this is a personal opinion, just as like a very empowering therapy.
Yeah.
It offers literally dozens of different types of coping skills, which I'm sure we'll talk about more,
Cool.
that balance those change and acceptance strategies I mentioned.
Mhm.
So it offers folks so many options to deal with and respond to what life throws at them.
Oh, yeah.
And so why that's so relevant for folks with marginalized identities is because they are often facing pretty significant life stressors
Mhm.
and have experienced various forms of discrimination and trauma and stigma throughout their lives, which DBT would also view as like a form of invalidation, kind of
Mhm.
a communication that that person, that you are not okay in some way. And when you are consistently facing stressors like that, having emotion regulation skills and skills that help you with compassion, self compassion, like you described earlier, is so vital for coping with what the world has given you and what they continue to give you. I think that I could speak more to that, but that's really what it comes down to in my head.
Yeah, no, I love it. So you said some big words that are scary for a lot of people.
Oh, yeah.
Change, acceptance, right? Validation,
Mhm.
essentially, right? Being heard. How do you navigate this and how would DBT and just your approach even, we don't have to necessarily just stick to the DBT, but how does that your approach, how does DBT, CBT, how can you work through these big ticket items? It's scary for people. Yeah.
It's super scary. Thank you for saying that. I do think that's often, I don't even want to say pushback because it's very legitimate, but just like a question that a lot of folks have.
Yeah.
So, yes, I think you nailed it. Change, acceptance, and validation are all kind of prickly in different ways. So, change,
Mhm.
DBT approaches change through that dialectical tension of change and acceptance, of recognizing that change is always a choice. So, I think that I, as a DBT therapist, and lots of DBT therapists focus on providing change based principles and techniques as a choice. So it's meant to be like, if you want to use this, here it is for you.
Right.
So
Right.
That's part 1. Acceptance.
Mhm.
I would say that my biggest feedback for that is usually if the word acceptance bothers you, which would totally make sense, then I offer the word acknowledgement
Mhm. Mhm.
because I think that's often what we mean in DBT. We don't mean being okay with something.
Mhm.
And in the world of stigma and prejudice and discrimination, we're certainly not okay. We certainly don't just accept that racism, sexism, homophobia, all of these things exist.
Right.
So it's more acknowledging that
Mm.
we live in a world that is racist, sexist, homophobic,
Yeah.
so that we can live our lives most meaningfully and purposefully, including working towards social change,
Right.
because we acknowledge the truth that we live in a place where these isms and systems of oppression exist.
Oh, that's hard in and of itself. You
Yeah,
know, these isms and navigating cultures, places, countries where they are very alive and so hard to get through, how do we help people? How can people find help? What are the first steps that somebody can take
Mm,
to not only recognize that they are experiencing and it's making an influence and impact on their lives, but then getting to a point where saying, this is actually something I need to work through. This is a big thing that is impacting my life and even how I approach my work, my relationships, and all of that. How do you get started?
that's a great question. Honestly, one of the first things that came to mind as you said that was I do think that therapy can be very helpful for folks and figuring out that process that you just described can be so tricky. And I think therapy is not always the most useful place to start for plenty of people.
Mhm.
And so I think what can be helpful is connecting with others who share
Yeah.
those identities that you share that are marginalized, people who look like you, talk like you, feel like you, experience the world like you do, and doing your best to get connected to community, whether it's organizations and people who are doing work in the community or just social, and you
Mhm.
can talk about your experience. I think your flag earlier towards validation comes up here. So often for all folks who are marginalized, but especially folks who have like invisible marginalized identities where it's not immediately apparent, like something like color of your skin, everyone can see, but sexual orientation, maybe not, or being autistic or
Mhm.
something that's hidden. So often there can be an experience of feeling like there's something wrong with you because you just have no basis for understanding. I'm different and different is bad. I think connecting with others like you is so phenomenally important for helping you realize, oh, I'm not alone in this lived experience. Actually, that other person has also had that life experience that I have, that I'm not making it up.
Right.
So just being able to talk to other people who can validate you. So
Mhm.
validation here is communicating that your internal experiences make sense.
Sure.
That can be so empowering and help you on this journey to start, I think.
Yeah, that's great. No, and we'll probably also talk about resources at the end. What are some of the unique challenges, mental health challenges that you've observed within these marginalized communities, specifically the LGBTQ plus community, one that's very near and dear to my heart. So, what have you seen? And let's explore that a little bit more.
Yeah. So I think that my interest in and my expertise in both DBT, emotional sensitivity, and LGBTQ folks is there's a reason and that these things overlap. And I think if you don't mind, I'd love to share the biosocial theory. So the
Yeah.
biosocial theory is the theory in DBT that we use to describe why some people have trouble with emotions.
Mhm.
So technically, it's the biosocial theory of emotion dysregulation, but that's just a fancy term to say, like, I have trouble managing my emotions, that I feel things intensely and then it causes me problems in some way. And in DBT, we think about emotion dysregulation as coming from an interaction between the biological and the social.
Mhm.
So, on the biological side, there's some evidence to suggest that there are some people who are just born more emotionally sensitive.
Mhm.
They feel emotions more intensely than other people. They feel emotions more easily than other people. And when they feel emotions, they last and linger for a while
Mhm.
compared to other people. That's often related to having trouble with impulsivity, but not always. But there's like a biological component that seems to be genetic, maybe hormonal. That's where research needs to be done. But like some people are just more biologically vulnerable to intense emotions. That's the bio part. The social part is in DBT, we talk about chronic invalidation. Validation being the communication that something about you and your internal experience isn't okay, doesn't make sense, is bad, wrong, crazy, something like that. And so when people grow up in an environment that invalidates them repeatedly, that can cause some problems. That's what chronic invalidation is getting at. So this is all the way from abuse and neglect, also just like a mismatch between a caregiver and a child. So, like a child who is emotionally sensitive, who has a parent who's less biologically vulnerable, just may not be able to understand the child's experience and will have trouble validating them and helping them cope with their intense emotions because all of us need to be taught how to cope with emotions growing up. But then anywhere in the middle where you're told your emotions don't make sense, don't come out of your room until you stop crying, your siblings over this, why aren't you over this yet? Any kind of communication that your feelings of emotions are wrong or bad or too much. And so when you have a child who is biologically emotionally vulnerable, who grows up in an invalidating environment, that's where they're never given the tools that they need to cope with those intense emotions. And that usually leads to one or two general things, or a little bit of both, where they struggle with really intense impulsive behaviors. That's the self harm, the substance use, eating disordered behaviors, things that really define a lot of folks' mental health struggles, or shutting everything down, suppressing and dissociating and numbing out and having difficulties connecting with themselves and with others. So, obviously, another category of mental health difficulty. As I
Mhm.
said, sometimes people can struggle with both. So, that's the general framework of emotion dysregulation. But one of the forms of chronic invalidation can be racism, heterosexism, discrimination in general, right? That is also a form of invalidation. And so if you grow up as a child learning that you're not okay, that the color of your skin, that your accent, that your sexual orientation, gender identity is bad, that's going to start to cause, we've seen research now show that can actually cause some of the intense emotionality that can be biological for other people. So, where DBT comes in and therapies like it was designed to give people the skills that they never received in childhood. That's why it's so skills focused. Like, you have intense emotions, we can help you with that. Here are dozens of things. But
Mhm.
that is why, no matter whether you're biologically vulnerable or experience trauma or experience discrimination growing up and invalidation of some sort, DBT has something to offer to help you with your emotions, to help you understand yourself, to help you connect with other people. There's lots of ways that it can help you in the area that you specifically struggle with.
Mhm. You hit on
Mhm.
so many great concepts. Yeah, absolutely. Like the isms and then being able to give yourself that sense of validation through the DBT work. That is such a beautiful bridge. And I think people need to hear that. I would say that on repeat because it is a tool that can definitely help you navigate not only what you've experienced, but what you may continue to experience in a more healthy way. So that's amazing. Yeah. Thank you for stating that. So, what role does advocacy play for you in this climate? We're living in really interesting times, I would say. What does that look like for you? I know it's something that you're passionate about, so love to talk about it a little more.
Yeah, I think the way I started answering the previous question comes to mind. To me, these things are intimately intertwined. There
Yeah.
is no being a therapist without being an advocate. I do
Yeah.
lean on the side of the the dialectical tension between therapists of the personal is political, right? Like these lived experiences in the world, whether it's stigma because of mental health struggles, which is real,
Mhm.
or stigma related to other marginalized identities shows up in a therapy room. As a psychologist, as a therapist and mental health expert, it feels vitally important to me to be out into the world spreading evidence based mental health information. And if possible, to be fighting all of those isms we talked about too, to the best of my ability. because I know and I understand from the decades of research at this point that those isms negatively impact mental health, and mental health difficulties negatively impact the
Yeah.
experience of those isms. So
Yeah.
for me, they are one and the same. So this can be advocating for a client personally, whether by talking to their doctor or consulting with them or helping them come up with tools and get involved in community, find those community spaces I mentioned, or trying to help and donate to and build up community organizations where I live, for example.
Mhm. Yeah. I think sometimes providers also have the tendency of feeling stuck, like we advocate, 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 and then we don't see change,
Oh,
and
yeah.
that gets us frustrated, right? So, what do you recommend to fellow providers to navigate these times and also to just stay motivated?
See, this is why I'm obsessed with DBT. It has both the change and acceptance. How
Yeah,
can I problem solve and advocate and
yeah.
assert and like work for change? And how do I take care of myself when I am changed out? When I am, you know what, hibernating after election results I don't like, or at recent bad news, or whatever, what do I do to take care of myself so that I continue to take care of others? So for me, broadly speaking, I recommend I practice DBT skills myself all of the time. This is part of the reason why I spread them because I believe in them. I've seen them work. But I think it's about knowing that this work is hard. We
Yeah.
are up against these systems. And so
Mhm.
also there's a scale from DBT called Cope Ahead, which
Mhm.
is pretty straightforward. You just plan ahead for difficult and stressful situations. And so I think about that a lot when it comes to any kind of advocacy, recognizing that this might not go the way I want it to do, recognizing that this is going to take a lot of courage or assertiveness that makes me uncomfortable or something like that, and planning ahead by really basics, eating well, sleeping well, getting ready for that day, and then knowing who I'm going to call when it doesn't go how I want, or like what distress tolerance skills am I going to use to take care of myself afterwards. So everyone gets to decide for themselves, but it's just continuing to go back and forth and accepting where you are on a weekly, daily, minute by minute basis. Am
Yeah.
I feeling ready for change? Am I willing to work towards change, or not? And both are okay.
Right. And pointing to your book and your cards, as I reviewed them and looked at them, I was so excited because it you can apply this, of course, with your patients, but
Mhm.
also for yourself.
Oh, yeah.
And what beautiful reminders. I love the cards. They were so great. The workbook's amazing. You put it in such great terms. Can you just share for our audience who might not have seen these tools what they're about and how they can use them and access them?
Yeah, thank you so much. My co-author and I on the book tried very hard, so it's always nice to hear that
Yeah.
it's understandable. So, as you mentioned, there for us specifically, I wrote a book with one of my previous colleagues, and then I also created cards that are the same content, all DBT skills, but just like in really small 100 to 150 word bites to make it a little bit more easy to people and like transportable theoretically. And that came out of getting feedback from folks that they want to be able to take the workbook with them, but it's big.
Mhm.
And then also, I do so much work on social media where I'm used to speaking about these things in 90 seconds. And so it was kind of a natural thing to just go ahead and put it and write it down on paper. So that's the really concrete what are these tools? There's a lot of other DBT tools available through my social media, as I said, YouTube, both mine and other colleagues, like lots of places to learn DBT skills, even if you don't have a DBT therapist.
Mhm.
But it's probably worth it to say a little bit like I've mentioned here and there what's involved in DBT skills, but let me explain it a little bit more. Where DBT skills are broken down into four categories. The first is mindfulness. I think
Mhm.
most people have heard of this, but DBT approaches it as a very simple being present in the current moment exactly as it is. So just being able to live your life and be aware of what's going on. There are also skills for distress tolerance, which include both skills for radical acceptance, which we talked about before. How can I sit with things that I don't like about my life that cause me pain, as well as skills for what we call crisis survival. So, when we're most upset, what are the things that we can go to help ourselves not act impulsively and hopefully even help us feel better in times that just feel overwhelming? And then another category of skills is emotion regulation, which is understanding emotions, knowing how you want to respond to them ways to reduce emotions that you don't want to be feeling, but then also use emotions that are helpful for you. I think that's a big thing in DBT. Like emotions are our friends, they're trying to help us.
Yeah. Yeah.
So, emotion regulation offers very specific tools for not getting rid of emotions exactly, but like working with. And then the last section of skills from DBT, the fourth section, is interpersonal effectiveness. So, this is assertiveness, getting what you want from relationships, saying no, but then also offering skills of validation that you can use to increase and improve intimacy with others, but also validate yourself and build some self compassion.
Mhm.
So, I feel like it's probably, or I hope it's immediately apparent to folks. These are life skills. These are things that I wish kids learned in school.
Right.
Sometimes they do, which is great, but I did not. These are things that can help everybody. And so these tools that I've tried to create give folks the opportunity to pick and choose what works for them or to get their feet wet a little bit if they are interested in DBT but have trouble finding a DBT therapist because it's definitely a difficult thing to find for some folks.
Oh, yeah. I love these resources that can get people started and help them with doing the work, which is so great. So, yeah, I recommend to everyone pick up the book, pick up the cards. They're available on Amazon, right?
Yes, yeah.
Yes.
They're available at most publishers, but Amazon for sure.
Okay, wonderful. So, the other component that I wanted to talk about was resilience. People might be doing the work, they might be in therapy and they found their DBT person. And now we're coming maybe to an end of what is allotted because of insurance or treatment periods or whatever.
Mhm,
How do we maintain? How
mhm.
do we build on resilience and keep that going?
Love that question. And one of the things that immediately comes to mind for me. So this is not unique to DBT. A lot of CBT folks
Mhm.
approach therapy this way too, but definitely in DBT, one of our goals often is giving the client tools to become their own therapist.
Mhm.
So, beyond giving you like all of the solution type skills for the problems you're experiencing, we very explicitly teach and offer you skills for understanding your own emotions, for problem solving and understanding your problems,
Yeah.
for how do I figure out what to do when what I'm doing isn't working, right? So, we make it so that you have the tools you need to continue to do this work without me. And then from there, all of these tools are also a part of resilience.
Mhm.
I think that one of my I have so many favorite DBT skills, but one of my favorites is a set of skills called the ABC Please skills. That's an acronym, and they are a set of skills designed to help you reduce emotional vulnerability, which basically is how to increase emotional resilience.
Sure.
So these are skills that you're meant to do, not like a one and done, like I'm upset, so I'm going to practice the skill. I do this on a daily basis. So one of the skills, for example, is accumulating positives in the long term.
Mhm.
We help folks figure out their values. What are they passionate about? What fuels them? What is their big why? And then we help them figure out how do we take what your values are and help you actually work towards those things, set goals and help other people, help yourself. That is what resilience is all about, I think.
Mhm.
Finding your reasons and your values for doing what you want to do in life. That is what's feeding and fueling beyond social connection, probably. So I do think that DBT helps folks with resilience long term because we're setting you up. The primary goal of DBT is actually to build a life worth living.
Right. Yeah.
It is designed to help folks with suicide and self-harm and intense emotions, but that's not actually the primary therapy goal.
Mhm.
So from the get, we're trying to figure out how can we make you resilient
Right.
using all of these tools that you'll learn in therapy.
Love it. Let's talk about that a little bit more too. Navigating the depression, the suicidality, the trauma, which we've touched on, of course, hope and compassion. How do you maintain that when you're dealing with these big ticket items?
One of the other foundations of DBT, we have a set of statements, I would say, that we call the assumptions of DBT.
Mhm.
And there are some of these like mantras or statements of like truths that we believe as therapists. And one of them is that everyone is always doing the best that they can do. Another one is that everyone always has to be doing more and needs to do better. So
Mhm.
it gets at the dialectical tension and the truth that you are whoever you are, wherever you are, however you're doing. You could be no other way. Everything that has come up in your life before this point, everything you're experiencing in this moment, and everything that you will experience moving forward shapes you. DBT views culture and society and these isms as a part of the clinical picture. And so we help folks realize that the interconnectedness of every human being, of everything that's ever happened to you, of you towards everything that's ever happened to you. And so I think that at its base is this recognition that you are good, you are okay. You are exactly where you're supposed to be. Maybe you're not where you want to be, and that's why you want to change and work to do things differently. And where you are right now is okay. And again, not in a I accept it, but I acknowledge that this is it. So I think that's a starting point that
Mhm.
then we provide on top of that a number of skills that help folks overcome and challenge negative self-talk, negative thinking, and
Yeah.
then specific skills for helping with self-validation and then
Mhm.
self-soothing and self-care. How can you treat yourself like you're worth taking care of?
Mhm.
Because that builds self compassion as well. So
Right.
come at it from that triangle I mentioned earlier emotions, behaviors, and thoughts. In there isn't body specifically, but I think DBT includes the body often too, the physical experience of life. We offer tools from all of those areas to help folks understand themselves, acknowledge their strengths, their weaknesses, their desires, all of these things, and learn how to balance that dialectic again of acceptance and change of who I am and that I am okay exactly as I am.
You hit on another one, the negative narratives, that chatter that the brain does not turn off, chatter that interrupts and brings forth doubt. What are your tools and recommendations for that?
My gosh. So, in order to work on anything, you have to be aware.
Yeah.
And so
Yeah.
that is why we teach mindfulness in
Mhm.
DBT. So, in the moment where you're having those negative thoughts, when
Mhm.
you're stuck in rumination, stuck in worry, stuck in shame, whatever it is, you have to notice that you're stuck.
Yeah.
And so, mindfulness skills are paramount for that.
Mhm.
And that can be both in the moment, but something that you learn how to practice more regularly as a mindfulness practice or meditation so that it's a muscle that you build up.
Mhm.
So that's almost always step one. On top of that, I would say that CBT skills come in for like, okay, can we help you recognize that I am bad, I am lazy, I am ugly, I am crazy, all of these common shame, negative thoughts, that is a thought. That's not a fact. And
Mhm.
here are some specific skills that we offer to help you see that's a thought, think more accurately and challenge that. And then it's not even necessarily depending on what you struggle with putting on like rose colored glasses. That's not the goal in DBT. It's seeing things accurately. And that's where we also believe in inner goodness. And we give you skills for that and approaching and understanding and increasing your
Mm.
ability in life to act in ways that you want to prove
Right.
to yourself that, oh, you know what? I am a caring person. Look at all of these caring things I do. And how
Right.
can I do more of that? Through
Mhm.
the like the accumulating positive emotions skill I mentioned.
Mhm.
And then all the distress tolerance skills that you need to ride the wave of
Yeah.
painful emotions.
Yeah.
Because when you're like 10 out of 10 in anxiety, shame, sadness, of course you're having those negative thoughts.
Yeah.
And in those moments, challenging the thoughts is not going to be easy. Most people can't do that. You have other skills to help bring that emotion down so that you can do that other work.
Do you have a method that you suggest to people to check in with themselves? You said it beautifully there. Am I at a 10 out of 10 with this, or am I at a 5 out of 10? And then knowing what to implement, when to implement it. Yeah.
Yeah, I do. I was like, do I have this as a card? I don't have it as a card in my deck, but I do mention this framework, the little booklet at the front of the deck. And I think we talk about this a little bit in the book too. But the way I break this down is if you feel You are what we call in DBT past your skills breakdown point. So
Mhm.
this is I am super stressed out. I am numb and dissociated. I feel totally overwhelmed. My thoughts are racing, or it just feels like my emotion is in control. So
Mhm.
this is 10 out of 10 for sure. But for some people, this might be 9 out of 10, 8 out of 10, maybe even 7 out of 10 for sensitive folks who don't have experience with coping. Anything above that breakdown point where the emotion is all I'm seeing, that's your cue to use skills that in DBT are more aligned with the distress tolerance skills. So this is
Mhm.
like distraction, this is nervous system regulation skills, especially. This might be physical self-care. Do I need to eat? Do I need to sleep? Do I need to just like literally take care of my body because my body is on the fritz? That's the cue, like, those kinds of flavors, feeling really, really hot or really, really cold emotionally is when you
Mhm.
wanna do those types of skills. And then when you're below that, where you're feeling an emotion, but you
Mhm.
don't feel overwhelmed by it,
Mhm.
where it still might be powerful and you might be feeling it strongly. You can think and see around the emotion. You feel in control of your response to it. That's your cue where you can use the other emotion regulation skills, mindfulness skills, interpersonal effectiveness skills, like pretty much everything else. And then you can jump around based on what your problem is. But that's the big split that I point out to people about what kind of skills am I supposed to be using when.
Love it. It's so great. And again, I think just such a great opportunity for people, our listeners, to dive in even more because there's so much within our own choice and control that we can apply. It's just a matter of coming back to that sense of awareness, as you mentioned, to be able to discern. That's so great. What would you say are some of the big challenges you've seen a lot of people face as they enter into any type of recovery journey?
I do think that this self-invalidation, this shame, this self-doubt, I don't mean to be a broken record, but I do think recognize that thoughts of this isn't going to work, I'm not going to be able to do this, I can't get through this, this is going to fail. All of those thoughts are thoughts. And they're
Mhm.
common. They're super, super common when you start something new, when you're starting anything new, but especially a mental health recovery journey. So recognize that's also not specific to you. That's a part of the process. And get ready to dive in past those
Mhm.
using the skills that your therapist or your treatment program can help you with. But no, that's normal. And that doesn't mean that that it's true that you're going to fail, that it's going to fail.
Yeah.
And then the other big barrier for folks, I think, starting recovery journey of any sort is feeling really overwhelmed. I think
Yeah.
a lot of times folks come to therapy, any kind of recovery program when they're really struggling. And it makes sense that's the case, right? But
Yeah.
they've reached past their threshold for
Mhm.
feeling like they can handle it on their own. And so that's great that you're getting help whenever you need it. And I think that can lead to folks feeling like, well, there's so many things I need to be working on. What am I supposed to work on?
Yeah.
And so I think a really helpful thing can be recognizing that as part of the process, that is normal. And with a therapist or on your own, doing some reflection around goal setting or just intention setting if you don't like goals. What is the one, the two, maybe the three things that if these things changed,
Mhm.
that would be huge. If I stopped doing this one behavior,
Right.
or if I started doing this one thing, like that would make all of the difference. And keep your eyes on the prize, if you will.
Mhm.
Usually, what happens is even though you're focusing on only one thing, you learn all sorts of skills and make progress that help the other things you care about too, and make those other things easier and faster to deal with by whenever you get to them. So you're actually not sacrificing working on everything by focusing. It helps you get where you want to go without being overwhelmed.
Wonderful. Okay. So, what are some of your favorite things to do for yourself to help you stay balanced,
Mm.
motivated, engaged, and even heal?
Yeah. There are the very stereotypical things where I do meditate, I do exercise, But of all of the physical self-care things, sleep is incredibly important to me. I like protect my sleep above all else. I need 9 hours, and right now I'm able to do that, so I do that.
Yeah.
But I think a big thing that I've been working on, which is restorative, but also a part of the work for me right now, is resting. I know I
Mhm.
just mentioned sleeping, but different, like when I am awake, doing things that aren't getting things done, that
Right.
aren't about productivity, that
Mhm.
are just for rest. And that doesn't mean I'm not doing anything, like whether I'm going on a walk or I'm a birder. So I've started drawing birds more recently, like doing something creative with no goal in mind. I've been really trying to focus on that because I think that's both restorative, as I said, but also goes against some of the mental health blocks that I have hit myself of like always trying to be productive or working towards certain things.
I am raising my hand to that one. That is such a common one for sure for me, but also amongst other providers.
Yeah.
We literally get trained to be in that mode of we have to have an end result. What's the real product and is that beneficial? So such a great reminder that rest isn't just about sleep. It's also about having activities that are truly restorative to yourself. And side note, that is actually a good end result. But yeah,
Yeah.
such a good reminder. Yeah.
Yeah, I
Yeah.
think for me, just bringing my mind back to the fact I'm not resting in order to be more productive. I'm
Right.
just resting because I'm
Resting.
human and that's okay.
Yeah. Yeah. I love it. All right. So if you could have listeners leave with one piece of advice about mental health, DBT, what would you like to land on and reinforce?
I think that one of the truths that I'm often repeating to folks that comes to mind here that we've talked about a little bit, but maybe I'll reiterate, is that emotions are normal and natural parts of being human. And if you are feeling something, there's a reason. Emotions also always come from somewhere. And so these complementary truths are so powerful to hold on to and they're so simple. But if we can recognize and remember and keep in mind that our emotions are designed to help us, that they're messengers and they're meant to be here and they're trying to help you, it can be so life changing for not feeling overwhelmed, for not feeling at enemy with your mind and your body. I don't know, maybe that's the truth from DBT that I'd love to reiterate.
Yeah, I love it. Beautifully said. What is one thing you wish you could change to help with just all the isms and destigmatizing and all of that?
I think that the thing that came to mind was I wish everyone
Mhm,
was taught dialectics in school. Because a part of dialectics also comes in the form of when we are in conflict or conversation with someone else, recognizing that their perspective has a kernel of truth in it, just as ours does.
mhm.
And just is so transformative again to ease conflict, to connect with other people, to understand different perspectives, and then therefore create change because there's movement and flow between people. So I think that comes to mind because I think that could make a lot of changes in very concrete ways,
For sure.
politically and environmentally.
Environmentally, yeah, 100%. What would you recommend on that note for parents or instructors to incorporate these concepts into the day to day?
I would say that the way to do it in a really concrete way is to learn and teach validation skills because you can both validate others and validate yourself. And so
Yeah.
getting into the process of finding the kernel of truth, of self validating. Actually, my lived experience is real and true, and here's why.
Mhm.
And getting better at seeing the kernel of truth that is true and real in the person in front of you. And that, as I said, eases conflict, helps you connect with other people while also holding on to your inner goodness and authenticity.
Yep.
And so I think validation skills are an easier way to get at dialectics interpersonally.
Love it. Love it. Great advice. We have one more question. It's our favorite question that we always end our sessions with, and that is, what does recovery mean to you?
I would say that recovery to me in true DBT fashion is living a life worth living.
Mhm.
That it isn't that it's the balance of change and acceptance, being exactly where I am and recognizing that it could be no other way, while still working to get more joy, meaning, and connection as I want to, but recognizing that I'm in control of that and I can build a life that's worth living to me.
Love it. Love it. Thank you so much, Dr. Fehling. It's been absolutely a pleasure to have you on and explore this wonderful topic of DBT and so much more. We're going to again link to your resources, but how can people find you?
Yeah, so I have a website. It is my name, kikifehling.com. But then for the folks who are on social media, I am basically on all platforms at almost the same handle every time, and it's DBT Kiki. So
Okay.
my
Okay.
name is KIKI for folks who don't see it.
Nice. Wonderful. Once again, thank you so much for joining us today, Kiki. Yeah.
Thank you so much. It was a wonderful conversation.
Thank you for tuning in to today's episode of the Recovery.com podcast. For additional information, resources, and to access treatment options, please visit our website at Recovery.com. We appreciate your listenership and are excited to have you join us on our next show coming soon.